Hello, this is Dr. Webster. Welcome back. So today I'm going to talk about diabetes and dehydration. I'm going to always reference the medical literature. I have an article here written by Dr. Richard K. Bernstein, medical doctor. And he tells a story in this paper about this patient that called him. Her regular physician was not available. Anyway, she had vomiting and diarrhea. And after speaking to her, he determined that she was severely dehydrated. And so it sounded so bad with all the symptoms she was having that he sent her to the emergency room. The hospital admitted her. They started putting in IVs. And as it turns out, because of her diabetes, she just let her body get so far dehydrated. So I'm talking to you because diabetes, heart disease, cancer runs in my family. And this subject this week is diabetes. And so the topic today is, if you're diabetic or if diabetic is in your family, what can you do to help yourself? So this is about prevention. So he said, why is it then that diabetics have a more serious time with dehydrating illnesses than non-diabetics? And so if you lose, and I'm just going to summarize, and again, I'm not an endocrinologist, I'm not a diabeticologist. There we go. That's a word in this article. So I'm not that, but I have it in my family, so I want to make sure I do the right thing. So let's say you get sick and you have some vomiting or diarrhea, or you just don't drink water. Okay, so your body needs water for nerve conduction, muscle contraction, digestion, and a lot of other things, and you don't have enough water in your gastrointestinal system because of being sick or not drinking. Well, your body's going to take water from your bloodstream to help maintain homeostasis in the human body. And so if the body starts taking water from your bloodstream and you already have glucose present in your bloodstream, then that means your glucose is going to go up. And the more your glucose goes up, the more possibly insulin resistance you're going to be, which is what we've already talked about, the underlying thing with diabetes. So you just can't afford to get dehydrated. So this guy listed 6 things that I'm going to talk to you about now. So dehydration causes transitory insulin resistance. We talked about that. During periods of dehydration, blood sugar will tend to rise. High blood sugar, as you know, itself leads to insulin resistance and further blood sugar increases. Blood sugar elevation from dehydration, in addition to blood sugar elevation caused by the viral or bacterial infection that led to the vomiting, the fever, etc., can cause even further insulin resistance. High blood sugar causes further dehydration on your kidneys. Think about your kidneys as they attempt to unload glucose and ketones by producing large amounts of urine. Increased dehydration causes higher blood sugars, which in turn further dehydration, all of which brings us back to number 1. Dehydration is a real problem. So we're going into the summer months, and I just want to encourage you, whether you're diabetic or not, your body needs water, and it doesn't need all these other drinks other than water. It needs water. It needs the best water you can get. So another article here, dehydration and diabetes. I just want to review some of the things they're saying. All right, some of the symptoms that you may have, your urine is very dark and yellow. You may have a headache. You may have dry eyes or mouth, feelings of dizziness or lightheadedness, tiredness or confusion. You know that. So often when patients come into the office, if I detect that they're fatigued or something, the first thing I'll do is give them a glass of water. How much water have you had to drink this morning? And almost always people are dehydrated. That affects your thought processes. This stuff is so huge. Okay, so during hot weather, the healthy body sweats to prevent overheating, and all of us do. This also occurs during exercise, and the muscles generate large amounts of heat. Normal sweating can cause the body to lose a large amount of fluid over the course of a day. If you're out, like so many people now, working in their yard or garden, you're dehydrating. Every time you blow out your breath, you're dehydrating. When you sleep at night, your body loses moisture to the bed covers. Every time you go to the bathroom, you lose hydration. Okay, so some things that they list to avoid dehydration. Let me just read these to you. If you have diabetes, drink regularly during the hot weather. Carry a bottle with you at all times. Don't rely on the thirst to tell you to drink. You should just sip it all during the day and don't wait to get thirsty. That's the best way. Increase your fluid intake before and after exercise. A general guideline is to drink 6 to 8 glasses of water or another sugar-free drink. We had a lot of discussion about sugar, and we'll talk more about it. Soft drinks are often very sweet and very high in sodium. Instead, drink water. Drink water, and these are what the experts say. When there's a risk of dehydration, avoid coffee and alcohol. Both are dehydrating because they increase the loss of fluids from the body. So if you're a coffee drinker like me, make sure you drink a lot of water behind your coffee. Extremely cold drinks can lead to stomach cramps. Really, your fluids are better at room temperature, your water is. Some fruits have a high water content and can be refreshing, but keep in mind that fruits contain the carbohydrate, so you just want to be careful of not getting too much of that. More information, there's a term here, diabetic hyperglycemic hypersolomolar syndrome, and it's called HHS. Now, again, I'm not an endocrinologist, I'm not an expert on diabetes at all, but I'm learning. So some of the symptoms that you are in trouble is that extremely high glucose blood levels, and you know that. Thirst, nausea, high fever, increased urination, weight loss, low blood pressure, numbness, loss of normal movement, speech issues, loss of consciousness. Of course, you're in trouble with that. But the whole point is hydration. Hydration, hydration, hydration for a diabetic person. Now, I also happen to use this Electrolyzed Reduce Water, and there's an article here in PubMed. And there's a lot of research that shows drinking this water is even better to help your kidneys and your endocrine system and everybody do their part better. And so I just encourage you to go on PubMed and just look up, diabetes and electrolyzed reduced water. And if you want more information from me, we have the machine here at the office. I'm happy to show it to you. But I just see enough research that it makes me, I have decided that I will drink it the rest of my life. So that's hydration, diabetes, drink the water. One of the goals that I have for our patients is I want you to drink 1/2 ounce of water for every pound you weigh every day. So if you weigh 180 pounds like me, then that's 90 ounces of water. So you want to get a container, especially if you work from home or if you have a desk, you want to get a container, find out how many ounces that container has, and do the math on how many of those containers you have to drink during the day, and make yourself do it. Your life, you're worth it. So thanks, I'll see you next time. Bye-bye.